It turns out that allulose, which is a rare sugar, comes from things like dates. It doesn't raise your blood sugar. It doesn't raise your insulin. In fact, if you take it before you eat a candy bar, it will lower your blood sugar response.
Wow.
Because it raises GLP-1. It acts like a GLP-1 agonist drug, but it has a short half-life. Like it might work for about 4 to 5 hours. But basically, you can take 10 to 12 grams of this sweetener. It won't have any calories, and it's going to lower the blood sugar effect of the meal. Like it's a therapeutic supplement. Like I am now making a point of taking it. I'm trying to get it in before each meal.
Wow.
There are doctors using it to get people to be able to titrate off of GLP-1 agonist drugs, to be able to use them as weight loss drugs.
Interesting. Dates are not really high in allulose. Foods that do contain higher amounts of allulose, for example, are kiwi, figs, jackfruits, and corn, for example. But all those contain a trace amount of allulose. As she put it, allulose is a rare sugar, and it's not found in high quantities, doesn't matter which food you're trying to eat. However, what do the studies say about allulose and dates in general? Because she also mentioned dates. Everybody that tasted dates before has experienced their sweet and tasty flavor. However, that begs the following question. Can people that have diabetes eat dates? That is a really fascinating question. Let's look at the science behind dates. This randomized control trial looked at date consumption and its effect on glycemic control, or in other words, blood sugar control, in patients with type 2 diabetes. This trial included 79 participants with type 2 diabetes. Their age was anywhere between 30 to 76 years old. This trial divided the participants into different groups. A date group that received 60 grams of dates on a daily basis. That's 6 dates, by the way. And a raisin group that received an equal amount of raisins per day. The duration of the study was 12 weeks. Let's look at what truly happened inside the arteries of these type 2 diabetes patients. No improvements were observed in glycemic control, again that's blood sugar control, insulin resistance, that's what they also measured, beta cell function or cardiovascular markers with date fruit or raisin consumption. Meaning dates and raisins, something that not a lot of people actually speak of, seem to be neutral, and that's very positive news, at least according to this one study. Participants were asked to follow their habitual diet and to report any physical activity changes. This is not the only study that was conducted on dates and blood sugar control. This randomized control trial included patients with type 2 diabetes and prediabetes. The study included 100 participants in total and lasted for 16 weeks, so 1 month longer, roughly speaking, than the first study we just looked at. And this study advised 50 people to consume 3 dates on a daily basis for breakfast, while the other group did not consume any dates at all. Other than that, participants were advised to continue their habitual diet. What were the results? No significant changes in HbA1c, I will explain in a minute what this means, and other blood sugar markers, and so did their lipid profile. No significant changes between total cholesterol, LDL cholesterol, triglyceride, and HDL. Also noteworthy, the BMI changes were also not significant between the groups. HbA1c is a blood test that measures the amount of sugar being present in your blood for the past, roughly speaking, 3 months. How it works is that it actually measures the amount of sugar that is attached to red blood cells. Red blood cells have a lifespan of around 3 to 4 months. A normal HbA1c is less than 5.7%, prediabetes is between 5.7 to 6.4%, and diabetes is diagnosed at an HbA1c level of 6.5% or above. The good news, by the way, is that not only dates, but also other fruits are associated with neutral blood sugar control. This meta-analysis included 19 randomized control trials. These 19 randomized control trials included 888 participants. The following forest plot indicates that compared to the control group, fruit consumption reduced fasting blood glucose concentrations, albeit many studies actually had no significant changes. That is seen by all the lines that cross the line of null, or the 0 line down in the middle. Every line that crosses it means no significant changes. And as far as HbA1c goes, well, no explanation needed here, practically meaning no changes happened within all these trials. The fresh fruit intake within these trials was anywhere near between 200 and 300 grams of fresh fruit on a daily basis. The fruit juice intake within some studies included in this meta-analysis was anywhere near between 200 and 250 milliliters. What about allulose? There is indeed research behind the claims she made. Let's have a look at the science. This meta-analysis of clinical trials included 6 studies with 126 participants. Although these were clinical trials, the sample size, meaning the participants included in these trials, was small. The studies used a different amount of allulose intake for every meal the participants ate. It ranged anywhere near 5 to 8.5 grams per meal. To summarize the results, allulose seems to improve postprandial glucose control. Postprandial means after a meal. However, there are a couple of limitations with this finding. Number 1, you would need to supplement allulose, because it is very unlikely that you can get to an amount of 5 to 8.5 grams of allulose by consuming kiwi, jackfruit, figs, and corn alone. There are also certain people that report digestive issues, such as bloating, stomach ache, and you name it. We also need further research. One of the biggest limitations is the low amount of participants being used in these studies. Furthermore, we need long-term research to observe what happens to people that take allulose on a daily basis for a very long time. In conclusion, I'm not sure if I can recommend allulose consumption right now, but I do recommend fruit consumption for people with type 2 diabetes. However, before making any dietary changes, please consult your doctor. Also, keep in mind that different people have different blood sugar level responses to the same food item. What are your thoughts about this topic? Feel free to let me know in the comment section. Thanks for watching, and I'll see you during my next video.